The CEO of pharmaceutical giant AstraZeneca says the company may still have a coronavirus vaccine by the end of this year. That's despite trials being put on hold after a patient got sick. Dr. Anand Parekh joins me now. He is the chief medical advisor at the Bipartisan Policy Center. Doctor, thanks so much for joining us. We're learning new details about this trial and the patient complications. Tell us what we know about that so far.
Sure, Joe. So it's a trial of about 30,000 individuals, and it appears that one of the individuals has developed what's called transverse myelitis, which is an inflammation of the spinal cord. Now, when you're dealing with 30,000 volunteers, it's not unexpected that one of them will have a new condition. I think the central question right now, Joe, for an independent safety review board is could the vaccination have triggered this condition? And are there others who may also have transverse myelitis? So I think there's a really thorough investigation going on right now. I think it's important that the vaccine trial has been stopped. And I think we're going to know fairly soon, hopefully, what the next steps are.
Yeah, so is there a timeline for when these trials might resume?
Well, I think right now, I think it's all up to the Independent Safety Review Board. They're going to really study this individual, this patient, try to understand how this occurred. Now, this diagnosis of transverse myelitis, it's a very rare condition. It's usually triggered either by the immune system or a virus. Actually, vaccines have not been shown in the past to trigger transverse myelitis, but they're going to really study it in depth, try to, again, understand the origins of this, and then they'll make a recommendation to the manufacturer.
Dr. Parekh, when we see complications like this in vaccine trials, sometimes it can be scary to people. So what is your message to those who are concerned about getting a vaccine once we do finally have one?
Well, that's a great question, Joe. And I think that the bottom line here is, we can't trade science or sacrifice science for safety. We want to make sure that what comes out of this process is a safe and effective process, a vaccine. Because otherwise there can be harm and there can be, as you're suggesting, a loss of confidence and public trust. And so I think the key message here is that we are seeing manufacturers, we're seeing regulators all focus on safety and efficacy. Nobody should be concerned about some artificial timeline or deadline. We all want a vaccine as quickly as possible, but we can't compromise safety and efficacy. And that's why I think it's a good sign that the manufacturer, in this case AstraZeneca, has stopped the trial, and you have a review board really thoroughly analyzing the situation with this one individual.
Dr. Parekh, thank you so much. We appreciate it.
Thank you, Joe.
A Michigan couple is in one of the toughest battles of their lives. Star Fudge gave her husband coronavirus. Now she's giving him one of her kidneys in hopes of saving his life. NBC News correspondent Ellison Barber spoke to the couple about this life-saving gift.
Working at a nursing home as a CNA and working COVID unit. Then on May 1st, in the middle of a 12-hour shift, my N95 mask broke when I was working at COVID unit. Within 24 hours, I had COVID. And then within 24 to 48 hours, he had it. So from that point on, as I start getting better, I start seeing that he's getting a lot worse. And then by week 3, had to actually call 911 to come get him because he started having seizures. He had no appetite. He couldn't keep anything down, and he had lost about a good 20, 30 pounds within a 2-week period.
You had health problems before. Do you feel like COVID-19 exacerbated those and made it worse?
Yes. Even my blood pressure was out of whack. I just got my blood pressure back somewhat right, but it wasn't even wacky like that at first. And then when I got the COVID, it was like I didn't have no blood pressure. Blood pressure was like 60 over 30 and stuff like that. It was bad. They were trying hard to get it back up.
I'm just glad we was able to get out here and go walking today.
How immediate is the need for you to have a kidney transplant?
Like yesterday. I mean, before we knew we had to go through that. But it seemed like when I got the COVID, it sped everything up. I got other health problems and stuff too, and it just made everything works. Like at first, when we were going through the kidney thing, everything for the kidney, I was like a 5-star patient. Then I got the COVID, everything just dropped.
I knew that things had to change, and I decided to go online and I started Googling how to become a donor. His transplant coordinator had called us and told us like that because of the COVID and other stuff, they had to put him on hold, but they released him off hold since he was free and clear of COVID and everything. And then she was like, I see that you put an application in online for the living donor. So she put me in contact with a living donor coordinator who helped me then get the test done to proceed to the next step. And she noticed, she said, you lost a very good amount of weight from when you first tried the year prior. It was actually on his birthday that they got their results back and they printed them up for us. It was so, I started crying because I was real excited. Then I told him, I'm like, look, I'm a match.
You gave him COVID and now you're giving him your kidney. It seems like it is just the fudges against the world. Like you're gonna make a way no matter what, all you've been through. I cannot imagine the emotions and that bond the two of you have. What's your hope for the future? What do you hope things look like for you guys in 6 months or a year?
Stronger. That's all I keep saying. I just want to be stronger like I was before all of these health problems and stuff like that. And I just want my kids to see us stronger and better.
He's a great dad. He's a great husband. I'm like, I couldn't ask for anybody better than this man right here. You gotta get strong, baby.
Ellison joins us now from Detroit. What a powerful story. I know this was a major decision for Star and her husband, and it wasn't easy. What do they have to do to make this transplant possible?
So they still, right when we met with them yesterday, they had just gone to another series of doctor's appointments. She says she has hit sort of the weight goal necessary. She lost 45 pounds since she started this journey after she survived her own battle with COVID-19. Both of them contracted the virus in May. So she's lost 45 pounds. Still, as you saw in the video there, walking, exercising every day, hoping to lose more, get a little healthier. They plan and hope to have this surgery in October or September, if they can do it earlier, no later than the end of the year. Right now, they're really just trying to kind of get ready physically, mentally, and also get their children ready for it. You know, Chris is unable to work right now. He does dialysis every single day. He obviously can't really be out and about in this COVID world. It's not safe for him. She left her job as a CNA at that nursing home because she felt like she just could not jeopardize her family's health anymore. She's now working as a cashier at Walmart. She says she's working with them and they've promised to have her job come back, but once they do the surgery. But right now they're kind of just trying to prepare mentally as well as financially to make sure that they can take care of their children and their family when they're unable to work for at least 2 months once they have this surgery. But really, and I think you could hear it in their voice, Joe, this couple, this family, they are just so optimistic. They have been through so much, and you want to ask them all about, like, what are the hard things coming up? What are you working on? What are your concerns? And really, they just try to find the bright spot in everything. They were telling me yesterday how what they're really looking forward to and what they're also preparing for right now, in addition to this surgery, is getting stuff together so they can go on a camping trip across the country. They say once Chris has his new kidney, that's something that they want to do. So they've been trying to get camping equipment here and there when they can, so they're ready for that day.
It's good to have something to look forward to. I know Star could be putting herself at a higher risk for coronavirus complications by donating her kidney. What can you tell us about how she's feeling about that?
Yeah, I mean, she said she's nervous. Anytime there's a surgery, she says she always feels nervous. But for her, she said the positives, the excitement of her husband perhaps being healthy outweigh all of that. He told me, you know, he is very worried for her. He also feels like he's taking from her again. He said she's there with him every day when he does dialysis, even before COVID. He's been through all of this. When he got COVID, by the way, first Star got it. She then tested positive at the nursing home where she worked. He got it, got sick. Once he was sent to the hospital, positive test confirmed that he too had the virus. The mother-in-law, Chris's mom, also tested positive for COVID-19. Star, while she was sick, took care of all of them and homeschooled all 3 of their children, one who is autistic. So, you know, she just sort of fights through anything. And she said, yes, she's worried about this surgery and some of the things, but for her, there's nothing more important than her family. So it's something that she wants to do, she's going to do, and they plan to do it in the coming weeks, in the coming months. Joe?
We're wishing them all the best and looking forward to hopefully seeing that camping trip. Ellison, thank you so much.
You bet.
Are you ready for some football? I know that's a rhetorical question, but the answer is yes. The NFL season officially kicks off tonight with new coronavirus restrictions in place for fans. The defending Super Bowl champions, the Kansas City Chiefs, will host the Houston Texans. While many NFL teams choose not to have fans, Kansas City is allowing some inside their stadium. That's where we find NBC News correspondent Sam Brock, who joins us now from Arrowhead Stadium in Kansas City, Missouri. Sam, good to see you. So tell us, first of all, why are the Chiefs allowing fans inside the stadium, and what can you tell us about the restrictions they're going to have in place?
Absolutely, Joe. Good to be with you as well. When you look at the overall landscape on this, there are 32 NFL teams. 26 of them, Joe, have decided, at least for the first game or two, they're not going to have any fans. Kansas City, in this case right now, is the exception to the rule with that. If you look over my shoulder here, we have Arrowhead Stadium, normally raucous Arrowhead Stadium. It holds 76,000 people. What they're implementing right now is about a fifth of that, 22%. And part of the rationale here, Joe, is that it's an outdoor stadium. Air is circulating, and they feel like they have enough space to really be able to safely have people aligned in a way that's not going to spread COVID-19. Now, certainly, when you talk about going to a football game, people are screaming, people are shouting, projecting. You got to keep that space. What the Kansas City Chiefs have done, they say they've run this by scientists and local health directors, is they're putting in pods of 4 to 6 people. Everyone within that pod knows one another. Within a given row, there's only 2 pods, which means if you want to leave and go to the aisle, you can do so without bumping into someone that you don't know. They're saying if they have to contact trace because someone does get the virus, it's much easier to do when everybody knows one another. Every third row in there is going to be skipped, so there's more spacing that way as well. And when it comes to concessions, they really would like everything to be automated so that there's not people waiting in lines, not an exchange of cash. The bathrooms, Joe, to keep density down, are going to have security guards in front of them, making sure not too many people are there at any given point in time. So those are all the protections they're putting in place. What this will look like, but the Chiefs right now are part of a smaller fraction of the league that feels comfortable moving forward with fans in the stands.
Bathroom guards. All right. Now, Sam, I know you've been talking to fans. What are they saying about these restrictions and the return to football?
Everybody across the board is excited about football coming back. But when it comes to expectations, it really runs the gamut. There are people who look around and say, this is a highly infectious disease. There is no way you're going to put a bunch of people in a football stadium and not see that spread, or for that matter, have a number of football players. There are 2,600 of them competing in the NFL. On the field, there's no social distancing on the field. They don't see how this is possible. Others look and say, well, look, you have other professional leagues like the NBA, the NHL, that have done this very successfully, granted with bubbles in place. Why couldn't this work with the NFL? Here's a sampling of a couple of people we spoke to on this very topic.
The minute somebody gets sick and then it spreads to so-and-so, they're going to shut the whole thing down. I think they're going to give it a try, but I don't see feasibly how it's successful because they can't social distance when you're tackling.
They're already motivated. I mean, they want to do this for Kansas City again, so I think that people are going to be at home celebrating in smaller crowds with the COVID. It's just going to be their intimate circles that they have.
But Kansas City's going to be ready. We're going to be ready for the Chiefs. We want Mahomes. We want the whole team for 2021. Yes. Right?
Yes.
And, Joe, maybe most interestingly, I had a conversation with a season ticket holder of almost 60 years today, been passed down from generation to generation. I asked him if he's planning on going to the games, at least early on in the season. He says no. but not because of health concerns. It's experiential. Does not want to go into a stadium right now, be spaced away from all the people that he would normally be interacting with, not get to barbecue or share all of those experiences and food. Instead, he said, I'd rather watch it on NBC at home with my dog. And once things are more back to normal, then go back and get the full football experience.
It can't beat watching with the dog. All right. Now, Sam, unlike the bubble sports you mentioned, we have seen outbreaks among players in Major League Baseball and soccer. So what do we know? What is the NFL doing to ensure the safety of players and staff?
Two rigorously implemented things here. One of them is testing, Joe. 44,000 tests were performed just between August 30th and September 5th. So that alone allows them to get a pulse on how many people actually have the virus. And of all those tests that were administered, only 8 of them were new positives, according to the NFL. 1 player out of these thousands of players and 7 non-player personnel. And the other thing is contact tracing. Roger Goodell, the commissioner, talking about putting devices on all of the players so they can track where they are going at all times. Should someone get COVID-19, it would be much easier for them to be able to isolate where it came from and who they've had contact with. So those are 2 important elements. He was asked specifically by Mike Tirico, of course, of NBC Sports, what the league is doing. What's the backup plan here should there be an outbreak? Here's what Goodell had to say.
We've got backups to the backups to the backups, and to be able to have experts in there that are watching closely. We've been fortunate, but we do expect they're going to be positives. We have, we have 2,000 people playing this game, another 1,000 coaches and personnel around in that area, and so we have to be prepared for that. And again, we are ready, but listen, this is a lot of uncertainty.
Just to add to a little bit more of what happened in that conversation, Goodell then said, we will do whatever it is that we have to do to stop an outbreak. So he left open the possibility that a team might miss out on a game. There could be a league suspension if it got bad enough, one would have to imagine. But so far, we've seen such encouraging signs, especially with Major League Baseball stumbling out of the gates, but getting the ship righted. There's a lot of hope right now that the NFL will be able to make this work. We're about to find out. Joe?
All right, Sam, enjoy the game tonight. Thanks so much.
Thanks, Joe.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.